Okay, so at the start of my shift, I would verify my order, make sure all the medications prescribed are appropriate. I would have also cross-referenced her allergies against the medications to prevent an allergic reaction. I have also checked all the parameters. So for digoxin, I made sure her apical pulse was greater than 60. I also made sure her potassium was greater than 3.5. And for her regular insulin, I made sure it was greater than 110 to give her some insulin. I'm going to go ahead and grab the medications in the Pyxis in the med room. So I'm going to go ahead and come in, wash my hands, and I would wear gloves when preparing the medications. So first I have laudafolines here, 10, 5, 26. I made sure none of them she has allergies to Tagamet and codeine. I made sure they weren't in those medications. So the first one I'm going to pull out is digoxin. It's 250 micrograms PO daily, due at 0900. So the first one I'm going to grab is digoxin. It's in 0.25 milligram tab, and I did the math, and it comes out to 1 tab. It's not expired. So I'm going to go ahead and put that in a med cup. The next one I'm going to pull out is famotidine. It's 20 milligrams IV BID, due at 0900. So here I have famotidine, 20 milligrams in 2 mLs, and it's not expired. Okay, so I'm going to pull that out. And then the next one is regular insulin, and we need 6 units. It's due at 0900. So here I have regular insulin. It's 100 units per ml, so I would be giving 6 units, and it is not expired. So I'm going to go ahead and wash my hands, put on gloves to prepare the meds. So the first one I'm going to prepare is famotidine. I cross-referenced it in the med book, and it says to dilute in 8 to 10 mLs of normal saline. 5 to 10 mLs of normal saline. I'm going to go ahead and dilute it in 8. It says to push at a rate of 10 mLs over 2 minutes, 5 mLs over 1 minute, so it would be 2.5 mLs over 30 seconds. So I'm going to go ahead and prepare this medication. I'm going to scrub the hub for 30 seconds. Time has elapsed. And I will go ahead and pull 2 mLs of med. Okay, 2 mLs. And I will go ahead and dilute it in 8 mLs normal saline. So here I have the 2 mLs. And I'm going to go ahead and dilute it in 8 mLs. So I'm going to go ahead and insert it. Okay, so I'm going to go ahead and dispose of this per facility policy. And here I have 10 mLs of medication. All right, and then I'm going to go ahead and label this medication. So here I have famotidine, 20 milligrams, 2 mLs, and it is not expired. Okay, I'm going to go ahead and put that one back and dispose of per facility policy. So the next one is regular insulin. So this one I'm going to prepare in the syringe, in the insulin syringe. I'm going to go ahead and scrub the hub for 30 seconds. Time has elapsed. And I'm going to go ahead and push 6 units of air. All right. And I'm going to go ahead and pull 6 units of insulin. would have got my verified with the second nurse, but here is 6 units of insulin. Okay, so I'm going to go ahead and label it. Okay, so here I have Practi, regular insulin, 6 units, and it expires 2/29. So I would go ahead and put this back into the Pyxis. Now I would need 2 flushes, alcohol swabs. Okay, so I would remove my gloves, wash my hands, and go ahead and go to the nurse's station to do my second check. Alright, so in the nurse's station, I'm going to do my second check. So here I have Lotta Fallings, 10/5/26. She has allergies to Tagamet and codeine. So I have digoxin, 250 micrograms PO daily, do at 0900. Here I have digoxin, 0.25 milligram tab. That would be the same equivalence of 1 tab for that 250 microgram dose, and it's not expired. The next one I have is famotidine, 20 milligrams. Here I have famotidine, 20 milligrams in 2 mLs. That is diluted in 8 mLs normal saline, and it's not expired. The next one I have, and it's due at 0900. The next one I have is regular insulin, and I'm giving insulin of 6 units. Here I have Practi regular insulin of 6 units, not expired. It's due at 0900, and I verified with the second nurse. So I'm going to go ahead and go into the patient's room and administer morning meds. So I'm going to go into the room. Hi, Miss Lotta Fallings. My name is Selena. I'll be your student nurse. So I would go ahead and provide some privacy, wash my hands. Hi, Miss Lotta Fallings. My name is Selena, your student nurse. I'm going to be giving some morning medication. Are you able to tell me your name and date of birth? Lotta Fallings, good. Your date of birth, 10/5/26, good. And I see you have allergies. What are you allergic to? Tagamet and codeine. Okay, I verified that none of our medications contain that. But for your I'm going to go ahead and do a third check of medications for safety reasons. Give me 1 sec. So I'm going to go ahead and do my third check. Alright, so my third check, I have Lotta Fallings, 10/5/26, and she's the correct patient, and I verified her allergies, Tagamet and codeine, none of them have it, so it's 0900. I'm giving digoxin, 250 micrograms, PO daily, and here I have digoxin, 0.25 milligram tab, and it's not expired. And then the next one is famotidine. It's 20 milligrams BID. Famotidine, 20 milligrams BID, and it's in 2 mLs and 8 mLs of normal saline. It's not expired. And Practi regular insulin, 6 units. And here I have Practi regular insulin, 6 units, and it's not expired. Do it 0900. Alright, I just did my third check. So Miss Lotta Fallings, I have some medication here for you. The first medication is digoxin. It's an antiarrhythmic. It's going to help you with your AFib. Some common signs and symptoms are nausea, vomiting, diarrhea. But if you do get those, let me know, because that could be a sign of toxicity. I also have famotidine, 20 milligrams IV, BID, twice a day. This is going to help prevent and treat peptic ulcers. Some common side effects are confusion, drowsiness. It's more like a preventative. And then I also have your regular insulin, 6 units. Some common signs and symptoms. It's a hormone supposed to help level out your blood sugar. Some common signs and symptoms are headache, tremors. Those could be signs of low blood sugar. So let me know if you do get those so I could check your blood sugar. Are you okay with taking these medications? Okay. So I would go ahead and wash my hands, put on gloves, and I verified that her digoxin, to administer digoxin to the patient, her apical pulse was greater than 60, and I checked for 1 full minute. I also made sure her potassium was greater than 3.5. So here's that first medication. Go, go, go. I'll put it in there. All right, go, go, go. Good. So the next one I'm going to give is, I'd be wearing gloves. The next one I'm going to give is famotidine to heal and prevent peptic ulcers. So first I'm going to assess the site. Do you have any pain? I don't see any redness, swelling, or tenderness. So I'm going to go ahead and scrub the hub for 30 seconds. Time has elapsed. So I'm going to go ahead and flush it. And make sure it's patent and you don't have any pain. Alright. Do you feel any pain or discomfort? No? Okay, good. So I'm going to flush 5 ml. Alright. So the next medication, I'm going to push for over 30 seconds, 2.5 ml. And then it would be 5 ml over 1 minute, and then 10 ml over the 2 minutes. So I'd be cross-referencing my watch, watching. Time has elapsed. Okay. Good. And then I'm going to go ahead and flush with the same rate. So I'm going to go ahead and flush 5 ml over 1 minute. Time has elapsed. Good. Alright, so I would dispose of per facility policy. The next one I have here is your insulin. Where's the last place they took it? Your other side? Okay. I'm going to go ahead and do your abdomen. It absorbs a lot quicker, so I'm going to go ahead and scrub the hub. I'm going to go ahead and disinfect for 30 seconds. And I'm going to go ahead and I'm going to perm, insert. Good. Alright, and then I'm going to cover. Alright. So let me know if you need anything. Let me know if you feel any dizziness, nausea, vomiting, diarrhea. As those could be signs of digitoxicity. And I would go ahead and dispose of per facility policy, remove my gloves, wash my hands. I'm going to go ahead and chart my medications. Call me if you need anything. Okay, so I would go back to the nursing station. I chart. So here I gave digoxin, PO, and I cross out initial. And here I gave famotidine. And then I gave regular insulin on the right lower abdomen. So I'm going to go ahead and sign. Alright, so I'm going to go ahead and show the camera.